How to learn human anatomy for a medical student. Thank you for coming to watch this video, and here I am going to give you a bit of a run through of the different approaches and techniques for learning human anatomy if you are a medical student, particularly if you are about to start your medical degree. Let me tell you a bit about myself. My name is Ali. I am a medical graduate, and I have taught clinical anatomy and clinical skills to medical students for over 15 years. And I would like to use my medical education experience to streamline anatomy education for medical students. Let me explain the purpose of this video. So this video is basically for first-year medical students starting their medical degree. So I would first like to say congratulations on beginning your medical journey. Senior medical students can also benefit from this video, and you will see as you go on. And this video is not about anatomy itself. This video is about anatomy learning. So it is about anatomy learning approaches and resources that you can use for that anatomy learning. Anatomy learning is a cause for stress and burnout among medical students. Medical students generally tend to find anatomy education quite stressful. So a major cause of this stress is the uncertainty associated with all education, and particularly, because I'm talking about anatomy, is about the curriculum, what is required of you to learn anatomy, assessment, how you will be assessed on it, and exams, they are a cause for stress, and conceptual understanding, which means leading to clinical application, that are you able to complete the curriculum, are you able to pass your exams, but even then, do you understand the anatomy that you've learned so that you can actually apply it in your work? So this video is to streamline anatomy education for medical students to reduce the stress so they can enjoy their learning and to ensure that enough knowledge is understood for clinical practice. So one of the first questions that in my experience I have felt that students have is how much human anatomy does a doctor need to know? And this is a very important question. Once this question is understood, then you can sort of make sense of how much anatomy you need to know. So no doctor needs to know zero anatomy. So if you are a medical graduate and if you are working in a clinical field, no matter what that field is, if you're using the word doctor, then there will be some level of anatomy you need to know. So there is no zero. But I have divided it into minimal, that what is the minimal amount of anatomy you need to know as a doctor, which doctors would need a moderate amount of anatomy, and then the maximum amount of anatomy. So maximum, how could you know a maximum amount of any subject? But I will come to that. And then there is the infinite group, the infinite amount of anatomy. Well, all subjects, there is no end to it. So this is how I'm dividing it: the minimal group, the moderate group, the maximum group, and I will sort of explain what infinite is. But these are the three: minimal, moderate, and maximum groups, and that's how I intend to divide medical students in these three groups, and from there explain how you should learn your anatomy. So let's keep going, and let me sort of explain what these different groups are from how I've actually categorized them. So the minimal anatomical knowledge is sort of needed by this gentleman. Now this gentleman, as you can see, is not wearing the white coat, but is still standing with doctors, and most likely is a doctor himself. But doctors in public health, in public policy, and administrators, they are the minimal anatomical knowledge group. These are the people that will be making policies and managing the health services. So they will not be using anatomy directly in their work like a surgeon might. But they still need to have a certain level of anatomical knowledge because they are making policy on health-related issues, and they are managing a health service. So they need to know, what the heart is and what cardiac diseases are and what the lungs are and what the abdomen is and what and how these different anatomical structures lead to certain particular diseases, and those are the diseases that are being managed. So they need to have a minimal amount of anatomical knowledge, and these people, the public health, public policy, and administrators, these are the people that I will be putting into the minimal anatomical knowledge group. About 10% of your cohort will go into these into the system. Maybe even more, but not too much more. But about 10% of your cohort will be in the minimal anatomical knowledge group. The next group is the moderate anatomical knowledge group. This is like the gentleman here, people in general practice, GPs, as we call them here in Australia, family physicians, if you're in the US, that's the term I believe they use in the US. But GPs, they need to have a moderate amount of anatomical knowledge because GPs deal with a very wide range of illnesses. And every one of those illnesses, almost every illness there is, has an anatomical aspect to it. Secondly, GPs need to know their physical examination really well because they are the ones that need to diagnose the illness. They also manage a lot of illnesses. However, if the illness is serious and needs specialist care, then the GP is the one who needs to be able to identify that. And if they're able to identify it, then they can send that person to whichever specialist is needed. And so GPs are essentially the gatekeepers. And so they don't need advanced or maximum amount of anatomical knowledge, which I will get to next. But they do need a very large or a significantly large amount of anatomical knowledge, which I have put in the moderate anatomical group. And so about 70% of your cohort will most likely go into general practice. And this is where the bulk of the doctors go. And so the bulk of the doctors that are going into general practice, I've put into the moderate anatomical group. And we will discuss your learning needs as this group. So let's keep going. So what is the maximum anatomical knowledge? Now, these are the doctors training as hospital physicians. Internal medicine if they are in the US. So all specialties linked with hospitals, all specialties, cardiology, neurology, nephrology, all these are all physician specialties, and then all the surgical specialties, general surgeons, specialist surgeons, all of them, they are in the maximum anatomical knowledge group. Another special group of people that I've included in this are the rural GPs. Now they're a special breed of doctors, and they need to know a bit more than GPs. And I have decided to put the rural GPs not in the moderate group, but in the maximum anatomical group, because of the range of work that they have to do. So these people who will basically work in the hospital or be associated with a hospital-linked specialty, they are about 20% of your cohort, and I have put them in the maximum anatomical knowledge group. So these, their anatomical needs I will be discussing under this group, the maximum group. Now I've got another group called the infinite anatomical knowledge group. Now these are doctors that are actually trained and are consultants in a specialty or a subspecialty. Now an example that I've used is an orthopedic surgeon who only operates on the anterior cruciate ligament of the knee. Now this surgeon who only operates on the anterior cruciate ligament of the knee knows the anterior cruciate ligament at a very high level. So this is what the infinite anatomical knowledge is, which people, because they do a particular area, specialize in a particular area, they see so much of it, they see so much of that, and they understand so much of those variations that they are specialists in that area. So another example is an ophthalmologist who only does cataract surgeries. That person would know the iris of the eye and the anterior chamber of the eye extremely well. Radiologists is a special group of doctors who will need to learn an infinite level of anatomy because of all the radiology they see. They won't be putting it into direct practice unless they're interventional radiologists. That too, they will need an infinite amount of anatomy for whatever intervention they are doing. But this is what I mean by infinite anatomical knowledge. Now, infinite anatomy cannot be taught by an educator or an institution. It is learned on the job. Now, I'm an anatomy educator. I've done this for almost 15 years, and I've seen anterior cruciate ligaments, and I've seen irises of the eye, but I have seen them in terms of different books and different resources, and I've seen them in the wet lab. So I have not seen the amount of anterior cruciate ligaments, not even close to what an orthopedic surgeon doing these surgeries would see, say, even in a month. And so I could never teach you those types of variations. And so the infinite anatomical group are doctors that are actually specialized. They're consultants. They're specialized in a particular area, and they see a lot of anatomy in that area. And this level of anatomy cannot be taught by an educator or an instructor like myself or an institution like a medical school. It is learned on the job. You will be training under a specialist, and if you are training into a specialty under that specialist, they will be the ones teaching you, and obviously you will also be seeing it yourself. So the infinite anatomical group, this is all I will be talking about them, and that's what I mean by the infinite group. So let's keep going. So which group are you? Are you the minimal group, the moderate group, or the maximal group? You may have already decided your future interest in the medical field, even in first year, which is fantastic. So you already know where you're going. It is okay if you haven't. So if, maybe a vast majority of you haven't. It is absolutely fine to not know how you are going in the future, and that actually might be also a sensible thing to do. It is also okay if you have decided, but you change your decision later in your medical career. So even though I am giving this information in this video right now, but from my experience, even if you've decided, life is such that you do not know where you end up. So it's very important to be open-minded. However, if you have decided and you are going in a particular field, I would still say be open-minded, but start your learning as early as possible for whatever your goals are. So, as I said, you may have already decided, which is all right. It is okay if you haven't decided, and it is also okay if you change your mind later in your medical career. But for what I am about to explain to you, if you are undecided, follow the moderate anatomy learning path. And I will explain. I will explain these paths to you. So if you're undecided, use the moderate path. All right. So before we go into how to learn your anatomy, we also need to go into anatomy teaching as a part of the medical curriculum. So you are in medical school. So every medical school in the world teaches anatomy. That said, anatomy curriculum varies among different medical schools around the world. It is different. Every medical school does teach anatomy, but teaches a different amount of anatomy. Again, that said, anatomy curriculum in medical school is usually appropriate for the minimal group. So these are the ones that are becoming public health professionals and administrators. So the minimal anatomical knowledge group, the anatomy curriculum in all medical schools is actually fine for what you are learning. It may even be a little too much. Nonetheless, for the minimal group, you must understand that your curriculum is more or less appropriate in the medical school. The moderate group, also the curriculum in the medical school is appropriate for the moderate group. Interestingly, even though there's a lot of debate in medical schools for what the medical curriculum should be, most medical schools tend to find a balance for the majority of the needs for the majority of the students. And because majority of the students will be in the moderate group, will be going into sort of GP training, anatomy curriculum in medical school is appropriate for the minimal and the moderate group. Anatomy curriculum in medical school is usually not sufficient for the maximal group. So whoever is interested in going into the hospital specialties, the anatomy curriculum that the medical school is teaching you is not sufficient. You will need to supplement your anatomy learning in some way. So this is, again, let me recap. Anatomy teaching in the medical curriculum, fine for the minimal and moderate group, not enough for the maximal group. We will discuss this further, so let's keep going. So what is the anatomy teaching methods in the medical curriculum? And the medical curriculum teaches anatomy through lectures, through tutorials, which are small or some sort of small group learning activity. This looks like a tutorial, or it may be a lecture, but it looks like no. It's more like a little bit of a practical class. And wet labs, which are dissection wet labs. So you will be spending time with actual cadavers, and you will be observing anatomy there. Usually, this is all in the preclinical years, which is if you're part of a graduate medical course, the first 2 years. And even in an undergraduate medical course, it is in the first 2 years. The first 2 years is where all the anatomy teaching happens. Not that you don't learn anatomy in the later years. You continue to learn anatomy for the rest of your life. But formal anatomy education ends in the first 2 years. And so your anatomy lectures, tutorials, and dissections will end in the first 2 years. Then in your specialties, when you're training, or when you're rotating in your specialties, you will be exposed to a lot of anatomy through different either procedures or different illnesses or clinical skills. So it keeps going, but it is not formally taught anymore. The medical curriculum also teaches, you do learn a bit of anatomy through physiology and pathology, because physiology is about the functioning of the body. And so they teach you how the heart functions and how the muscles function and how the bones are formed, etc. So there is some anatomy there. Pathology, always, all diseases have an anatomical aspect to them. Almost all diseases have an anatomical aspect to them. Your PBL cases, because they will be part of it will be a case of some sort of illness, so there will be an anatomical aspect to it. And clinical skills, when you're learning to do your histories and your physical examination, they have an anatomical aspect to them, and obviously a physical examination is an anatomical examination in a way. So apart from your lectures, tutorials, and wet labs, you also will be learning anatomy in your preclinical years in your other subjects as well. So the medical student, now the medical student is a special breed, and they are truly remarkable in a lot of ways. They have a proven track record of hard work and dedication, intelligence, and leadership. So these are phenomenal qualities, and because medical school is so competitive, the people with these phenomenal qualities find their way into it. However, these same qualities, when you put all of these people together in one place, it can lead to a lot of stress, anxiety, and burnout. Medical students will have to put extra hours of study. It is just expected in the medical curriculum, which is already full-time. The curriculum itself is already full-time, that whatever the full-time curriculum is, you are going to have to put in extra hours of study on top of that. Now because of that, medical education does become poorly organized, because a lot of people teaching expect that, all right, now I've mentioned this part, when will they learn it? They will learn it in their own time. So when all this education happening in medical school, where educators are expecting medical students to learn this in their own time because the education is already full-time, then what happens is a term called cognitive overload, which is excessive on medical students. So because of this cognitive overload, medical students burn out. So my objective in this video is to streamline your anatomy education, so to reduce anxiety and burnout, and at the same time, increase learning. So I am making this video particularly for the medical students, so that even though medical education is so stressful, I would like to take the stress of anatomy education out of that. Now, I don't think I'll be able to achieve that with this video. However, I do feel that it will give some context initially to your anatomy education, especially when you're starting out. Okay, how to learn anatomy. Now we're getting to the actual crux of the matter. So for the minimum group, how to learn anatomy. This is for the minimum group. These are for the people who have decided that they are going into public health or health policy or administration. Just focus just on the anatomy curriculum of your institution. You will not need anything more. So whatever medical school you are part of, just learn what they are teaching you. Do not try to learn anything extra. It is enough. Attend your lectures. Don't miss them. Attend your tutorials. Do not miss them. Attend your labs. Do not miss them. Apart from that, do not spend extra hours studying anatomy. You do not need to. You can use those extra hours. As I said, all medical students are expected to put in extra hours. Use those extra hours to learn non-anatomical topics that are more suited to your interests. So if you are into, say, international health, and you're interested in the availability of anti-malarial drugs in sub-Saharan Africa, so go learn that. You know, there are a lot of things that may interest you. And spend that time learning that stuff. If you have decided that you want to go into public health or policy or admin, then just attend your lectures, tutorials, and labs of anatomy, and just be regular attending them. You'd be surprised how much you will learn just by attending these things. And there will be a lot of information that is taught to you in those lectures, tutorials, and labs that you will not understand, and they expect you to learn those in your own time. But don't worry about it. Use that spare time to learn your other topics that interest you. Again, if you have any other questions or concerns, put it down in the comments and we'll discuss it. All right, so that's my advice to the minimum group. Now let's move to the moderate group. Now these are the people that will eventually train as general practitioners and GPs, or go into family as a family physician in the US. I'm missing that name, being spending most of my career teaching in Australia. All right, now for the moderate group, training to be GPs, focus on the anatomy curriculum of the institution, the same thing I mentioned to the minimum group. Attend all your lectures, tutorials, and labs. Do not miss them. Then you do spend a few extra hours studying anatomy in your own time to reinforce anatomical concepts that were not understood. As I said, your lectures, tutorials, and labs are great, but there will be things in them that you will say, oh, I didn't get that, or what was that, and maybe I need to understand that. Do spend a few extra hours studying weekly in those. You find another anatomical resource to supplement your learning. We will be discussing these anatomical resources right in this lecture. So some of the anatomical resources that I will be discussing in this lecture, find that resource and use that to supplement your learning for the things that you have not understood in your lectures, tutorials, and labs. That said, do not attempt to learn more anatomy than what your institution is teaching to you. So if it is not in your lectures, if it is not in your tutorials, if it has not been covered in your labs, do not try to learn it. As I've mentioned, that for the moderate group, people training as GPs, whatever is being taught to you is actually quite appropriate. If you understand this stuff, which means that you attend these lectures, tutorials, and labs, whatever you do not understand, you try to learn through an anatomical resource by a few extra hours every week. And that is it. If you just do that, then you will have sufficient anatomical knowledge to take into your clinical years, which are your third, fourth, and maybe fifth year. And in your third, fourth, and fifth year, you will learn enough in those specialist areas that anatomical knowledge is appropriate to take you into your GP training. Now, in your GP training, of course, you will have to revise these things, and you may have to learn a little bit more here or there, but it should be sufficient. It should be sufficient. You won't be caught off guard in your training if you followed just learning what was taught to you in lectures, tutorials, and labs. You will be all right, personally, from my opinion. That said, if you agree or disagree, or if you have any other questions or concerns, please mention it in the comments, and I will be more than happy to discuss it with you there. Okay, that brings us now to the maximum group. Now, these are the students that have decided that they want to specialize in the hospital. They want to be an oncologist or a spinal surgeon. Now we have to focus for the maximum group. Now, focus again, the same advice given to the minimal and moderate group is focus on the anatomy curriculum of the institution. Do not lose that curriculum. Attend all your lectures, tutorials, and labs. Now, you need to spend an extra 5 hours or so of your own time learning anatomy. This is on top of this. So you're going to attend all of this, and then you're going to put an extra 5 hours a week on learning anatomy. I wouldn't say you need to spend more than that, but that we can, as I mentioned to the previous groups, come into the comments and discuss. But 5 hours a week is good. And you need to find an appropriate and complete anatomy learning resource and use that to supplement your anatomy learning. Now, in this video, I will be going through these complete resources. So again, let me explain to the maximum group that whatever your institution is teaching you, it is immensely important that you learn that and you attend all of that. However, it is not enough. If you are going into the hospital training, there is more you need to learn, and I will explain that. As a matter of fact, this video goes on and explains what you have to do more. But I just want to, at this point, tell you that you need to attend your lectures, tutorials, and labs, but then you have to spend an extra 5 hours a week on anatomy learning, and this needs to be organized. And so you need to find an appropriate and complete anatomy resource that we will discuss and organize your learning from there. So for the maximum group, we still have a bit more to discuss, and we will continue to do that in this video and onwards. So stay tuned for this group. Let me just say that. Okay. So this brings me to a very important resource, which is the wet lab. Medical students, the wet lab is an integral part of your education. It is one of the best resources to learn anatomy. The wet lab, the cadaveric lab, where there are actual human bodies that have been donated by people who have donated their bodies to science, and they have been professionally dissected, and they are there for your learning. Now, I also want to emphasize in the wet lab that the wet lab is a dying breed because of budget cuts. Throughout my years of teaching anatomy, it's always been the wet lab. The administrators of big universities are always trying to pull students into 3D learning and augmented reality and all these fancy forms of learning anatomy. But they're always eyeing that, maybe we can get students to go into there. And so we can just shut down the wet lab because it is so expensive to run. But I don't think it will happen. I've seen it happen in some institutions, but then the medical students complained, and then they had to open it again. But it is a point of contention throughout the medical community around the world, where wet labs are sort of being because of its expense, they're being reduced. So please, whatever opportunity you have, go to the wet lab. It is one of the best anatomy resources you can, and you must use this time. It is also hard to get access to the wet lab after the preclinical years, which is your first and second years. I've seen senior medical students and interns and junior training doctors, including surgeons, that would love access to a wet lab, but they're so busy they don't have time. And this little time they get just organizing for a wet lab to open up in the time that they're free so they can quickly go and learn, it becomes a bureaucratic nightmare for them. And so it is very hard for training doctors to get access to the wet lab. So in the first 2 years, whatever time you have in the wet lab, use it as much as you can. And if you have spare time and you can get your lab open in your own personal time with a group of students, do it. Some med schools do not have that option. They can only do the wet lab in the scheduled time. Obviously, don't miss that. But if you do have an option to get it open at another time, please do. Always join demonstrations and personally demonstrate as often as possible also, because when you see a specimen in the wet lab, and especially if you haven't learned anatomy or you're new to anatomy, it's just so much stuff in front of you and it is hard to make sense of anything. So if you are lucky enough that you have demonstrators there demonstrating anatomy to you, so always attend that demonstration. It is invaluable. And if you do know any anatomies, always in a medical school, we've got physiotherapists or radiographers. These are the two groups that know their anatomy when they come into medical schools, or anyone who's done a med-sci degree who has majored in anatomy or has spent extra time in anatomy. These are the three groups of people that I've sort of seen that have good anatomical knowledge. If you are one of them, then demonstrate. Because not only does that help your colleagues, teaching is the best way to learn. It reinforces your knowledge. And if you are not that person, or you are that person, but you learned something new, try to demonstrate as often as possible also. So always join demonstrations and personally demonstrate also as often as possible, because teaching is the best way to learn. And furthermore, I would not recommend dissecting. Dissecting is very time consuming and the skills you learn are not really relevant even for your surgical practice. Use prosected specimens, prosected specimens, that's wrongly spelled, but use prosected specimens, which are dissected by professional dissectors in the wet lab, and they demonstrate anatomy really well. I would recommend that at least in medical schools. There are dissection courses available part-time, or if your anatomy lab does allow dissection, consider it. My only issue is that it is very time consuming, and if you had that time, if you spent looking at prosected specimens, that might be a better use of your time. That is my personal opinion. There are people out there that do feel that they learn a lot through dissection. And if you do have the opportunity to dissect and you feel that is useful for your learning, feel free to do it. So in the end, for this slide, I would just say never waste your time in the wet lab, and every opportunity you get to go to the wet lab, please go. It's a great tool for learning anatomy. It is hard to access after your preclinical years, and it's just we're trying to save it, but it's budget cuts are only reducing the wet lab time and the wet lab resources that we have. All right, let's keep going. All right, so where I've come to now is to now discuss the complete anatomy resources that are available out there for you. So a complete anatomy resource is one. Oops, gone down. A complete anatomy resource is one which has all the information needed by a doctor training to be a hospital practitioner. So this is a resource that is relevant for the moderate group and is important for the maximum group. It is not too important, as I mentioned before, these resources for the minimal group. So complete anatomy resources are either books, which anatomy text with diagram explanations. There's some great books out there, and having anatomy in the book form has been around for several hundred years. And the last 100 years, and particularly in the last 60, 70 years, they've actually become really good. So there's books, which are anatomy text with diagram explanations, which are a complete anatomy resource. And in the last 10 to 15 years, or about 20 years really, online resources have actually, some of them have become very good. And they're similar to books with text and diagrams, but they can also be interactive with videos and quizzes, etc. So complete anatomy resources will either be a book or online. And they are something that have all the anatomy that is relevant for a doctor training to be a hospital practitioner. So let's discuss a few. Oh, before we go there, this is how I arrange the slide. Incomplete anatomy resources. So there are a lot of incomplete anatomy resources out there also, so you have to be wary of them. Any book with anatomy and physiology written on it, like this one, look, this is a great book for medical science, but for medical students, any book with anatomy and physiology collectively, it actually doesn't have enough anatomy in it, and also doesn't have enough detail of physiology in it also. So these anatomy and physiology books are actually very well suited for med-sci students, and they're pitched perfectly to that, but medical students, this is not enough. Almost all YouTube anatomy-based channels, including my own, are not complete. I have gone through almost all the YouTube channels, and I've noticed that some are actually appropriate, some are great, some have some very relevant information, some I've used for my own learning, but none of them are complete. It's a mismatch. They have some things, they don't have some things, and so no individual YouTube channel is complete. And most anatomy websites online are not complete. A few are, which I will discuss, not all, but most anatomy websites online are not complete. So, as I mentioned previously, we will look through complete book anatomy resources that are books and online, but there are a lot of incomplete anatomy resources, and I don't want you to spend your time going through them. So there are books with anatomy and physiology written on them, and a lot of these channels. Anyway, I will go through the complete anatomy resources that I have found so far, and so anything that are not them, I would consider they're not complete unless they may be, and I may be wrong. So let's go to the complete anatomy resources and let's start discussing them. And let's start discussing it with the great anatomy book, Gray's Anatomy, which is not the sitcom. Gray's Anatomy is the Bible of human anatomy. It is a big, thick book. The current edition has about 2,000 pages, and it's actually a large size of page also. So it's about 2,000 pages. It continues in the name of its first author, Dr. Henry Gray, a legend in the field. And so Gray's Anatomy has immense historical importance. Dr. Henry Gray learned his anatomy through dissection, and decided to write a book on anatomy using illustrations made by his colleague, and that was the first anatomical book. And so from there on, the tradition continues, and Gray's Anatomy is, as I mentioned, the Bible of human anatomy, and has immense amount of anatomy in it. Now, Gray's Anatomy is immensely useful for anatomy researchers and academics. I had we've in every anatomy department you'll find a Gray's Anatomy in there, but I would not personally recommend it for medical students, even the maximum group, because it has too much detail. It is immense amount of detail. Excuse me, and I would not recommend it. That said, it's a complete anatomy resource, and feel free to go through it, which I would recommend at the end of all anatomy resources. I would recommend all of you to actually go through all of them to see which one suits you the best. So please do go through it. You will find it in your library, and see how it's written, see the detail, and see if it is if it is good for you. But I would not recommend it. It really does have too much detail, and it is useful for researchers and academics, but for a medical student, even for the maximum group going to train into hospital training, it is just too much. It is too much information. So I would not recommend it. But that said, it's a complete resource, and feel free to look through it. All right, that brings us to a book by Moore and Daly, which is clinically oriented anatomy. Now it's into its ninth edition. It was even around when I did medical school about 15, 20 years ago. It's among the most popular anatomy books for medical students. It really is. You will find it in your somewhere in your med school or in your. You'll definitely find the library. You'll find PDFs of it. It might be in your PBL rooms. This is an appropriate amount of detail for the maximum group. So this is a complete anatomy resource. And it's also a useful resource for the moderate group. And it's my personal favorite, and I would highly recommend this book for medical students, especially the maximum group. And even though I'm publicly recommending it here, I have no financial or other relationships with the publishers or authors of this book. And there's no conflict of interest here. It's my personal favorite. It is about 300 to 400 pages. And the pages are relatively smaller in size, and the text is larger compared to Gray's Anatomy. It is really well written. It has all the relevant information, great diagrams, great text, and clinical relationships and clinical relevance. So yes, so this is one book that I would recommend, and it is a complete anatomy resource. So let's move on to the next one. Another book, Last's Anatomy. It's among the first anatomy books written for medical students. Unlike Gray's Anatomy, which was also written for medical students, but it was an exercise in anatomy academia. Now, this was particularly written for medical students, written by a doctor called R.J. Last. Dr. Last was a surgeon, so this book actually has a surgical focus. It also has a historical significance because it was the first, anatomical book written for medical students and particularly for surgery. So I would recommend this book only for those medical students with a surgical focus or a surgical interest. So if you're interested, if you are interested in surgery, you will be in the maximum group. But at the same time, if you're not thinking of a hospital specialty as a hospital physician but surgeon, I would recommend this. This can be recommended to you. So if you're considering, let's say you want to become an oncologist or a cardiologist, I would not recommend this. But if you're thinking of surgery, then I would recommend this book. That said, students with a surgical focus are not disadvantaged by other complete resources that we will discuss here. So if you're interested in becoming a surgeon and you've decided that you do not want to use this resource, you want to use the other ones that we've discussed, then you are not disadvantaged. You are absolutely not. That said, if you were rotating in surgery and you told your consultant that, oh, I've read Last's Anatomy, they would be amused. They would definitely be amused. You can even tell them I've read Gray's Anatomy and they would think you're crazy, but maybe not, but so Last's Anatomy is good, but only for medical students with a surgical focus. It has historical significance as a book for that was the first book that was surgically oriented. And then again, I have no financial or other relationships with the publishers or authors of this book. I do not mention this again, but every anatomy resource that I'm recommending from this point onwards, I actually do not have any relationship with the businesses. Okay, let's take us now. The other complete anatomy books, Snell's Clinical Anatomy has been around for a long time. And Gray's Anatomy, not the actual Gray's Anatomy, but Gray's Anatomy for students. It's a Gray's Anatomy for students. This is actually new. As you can see, it's the 4th edition, so this hasn't been around for that long. But these two, they're rated high among medical students. So absolutely go through Gray's Anatomy for students and go through Snell's Clinical Anatomy. Go through these previous ones also. Go through Last's Anatomy. Go through Moore and Daly's Clinical Oriented Anatomy, and also go through Gray's Anatomy for students. These are the books that you need to find in your library. Don't buy them. Find them in your library. Find them if you can find a PDF of them. Read through them, and your library will definitely have these books. Read through them, see which one you like, and that may be your book of choice to learn your anatomy from. So there you go. There are other anatomy resources as well. These are not complete, but they have a purpose, but they may not actually be necessary. So they're atlases. One very famous and historically relevant atlas also is the Atlas of Human Anatomy by Frank. I'm not sure if it's F. Netter. I'm not sure what the F stands for, but Dr. Netters was a painter, and he actually spent a lot of time painting cadaveric images, which are actually quite brilliant, not only in their painting, but I can't explain it. When you start learning anatomy and you see how he's actually positioned those all those structures and how he's explained them, and how he's explained the clinical relevance of them, it's actually quite amazing. So great work. And to date, no one has done such a brilliant work. So, and you will see Netter images in your clinical year, in your medical school. I mean, in some lecture or the other. These you will see Netter images. They're everywhere, and they're classics. So, but however, Netter's not the only one with the atlas. Another atlas at that time was Grant's atlas. Now, this is a Grant dissector. It's not an atlas, but Grant also made an atlas about the same time as Netter, maybe slightly earlier. Can't remember particularly. The Moore and Daly book comes with the Grant's atlas, so you will see that. There are other atlases also available. That now there are a lot of digital atlases that have been made by not by somebody who's hand painted them, but on the computer. They're also good. You can find them. A dissector is actually a dissection manual. That is only useful if you are dissecting. So dissectors do teach a lot of anatomy, but they teach you in the way of dissection. They'll teach you how to make an incision on the skin, and then what you see under the skin, the subcutaneous tissue, and what are the nerves that you see there, what are the arteries and veins that you see there, and it will then take you from layer to layer to layer of dissection. So if you are dissecting, you can learn a lot of anatomy through a dissector. But if you're not dissecting, a dissector actually makes no sense, and so it is not useful. And they're atlases of human dissections themselves. So they're images of dissections, meticulous dissections, brilliantly done, great pictures of those dissections, and very well labeled. So these atlases of human dissection atlases are always available, very useful tools for the wet labs, and they're usually available in the wet labs. And so you will find them there. But none of these resources are complete anatomy resources. They're just tools. And they are also not necessary. So if you chose one of these books, these previous books that I'm talking about, there is images and atlases in these books. So there's nothing that those atlases will give you that you do not have here, and so you use these ones also. And so they're not complete and they're not necessary. They are a useful tool though, and so I'm mentioning them here. All right, let's keep going. All right, anatomy resources, which are reviews. Very famous reviews are the Board Review Series, BRS, Kaplan, and USMLE, Kaplan and Lippincott, and there are many. I mean, if you start looking for anatomy review resources, there are many. Now, these review resources are useful for review. They're great for MCQs. Another type of questions, if you were giving your USMLE, if you were American, these are great. They're great for also helping you pass your own exams, which are Australian-based. But they cannot be used for initial learning. You cannot learn anatomy through these. They can give you the salient features that you need to remember, but you cannot learn your anatomy through them. They're very good for the minimum group because you can quickly go through the important things of anatomy that you need to learn without spending too much time on concepts. They're actually very useful for the minimum group, and I shouldn't recommend them as an anatomy educator, but you'll be using them because they're good for a quick review. They're also good for the moderate group. They're also good for the moderate group, but for the maximum group going into hospital physician training, there is not enough information in them because obviously the review and the information in them is obviously very important. You should know that, because that is the amount of information appropriate for the moderate group. So you should know all that information, but it is not enough information for going into hospital specialties. So these review books are great for MCQs, for review questions. They're great for testing your knowledge. They're great for review before exams. Fantastic for that. They're also excellent resources for the minimum group. They are useful resources for the moderate group. I would advise them for the moderate group also. They're also great resources for the maximum group, as far as you understand that they are giving you enough information to pass your exams and for what anatomy is relevant generally, but they do not have enough information for the amount of anatomy you're going to need when you walk into your hospital training. So I hope that's clear. Let's keep going. All right, now we've come to the online resources. So we've discussed the books. Here, I've gone through the online resources that I found useful during my time in teaching. Most of these have come up, honestly, in the last 5 or 10 years, really. And I saw them develop from like rudimentary websites to actually complete anatomy resources. Number 1 on the list is TeachMeAnatomy. I put this number 1 on the list because it is free. So the whole text, it is a complete anatomical resource that is actually free. Now, the other books that I mentioned, I'm sure you could find a PDF version of it that you could get access to free, or you could get it from the library for free, but the book itself is actually not free. And so I find this quite good about TeachMeAnatomy, that it is truly free online, that all the text and all the images are free, available for everybody. You will see TeachMeAnatomy. You Google any anatomy structure and TeachMeAnatomy will be in that list. So medical students would most likely know of TeachMeAnatomy if they've been in med school for 6 months or more. And I have to say, it is truly a complete anatomy resource. It is a bit less detail than the complete anatomy books, but the detail is, still appropriate for a complete resource. So I would say it's a great resource, it's a free resource, simple text and reasonably good images, and available online and free. They do have a premium service. If you pay them, you can do quizzes, reviews, and a 3D atlas. So they have a 3D digital atlas. You can see a bit of it down there that you can use. And so that is also useful. So yes, please check out TeachMeAnatomy. See how it is structured. Look at the detail and see see whether it suits you or not. But I would rate it as a great resource and a complete resource. All right, let's go next. Next is Kenhub. Again, that is also there with TeachMeAnatomy. Registration in Kenhub is free, and text and images are free after registration. At least that was the case about 6 months ago. The text is actually very good, and the images particularly are excellent. I mean, the images in Kenhub are among the best, really. They have a certain philosophy to them, which I would say that, I can't explain it here, but they have a way of isolating in an image every individual structure. And I think they're able to do that because of digital images now, that, they can produce the same image and highlight separate things. So I think their images are actually quite great and among the best. And the way they're structured are also very good. The text is also really good. However, these things, some of the images are available for free. You can Google them. Some of the text is also available for free. But if you want all the text and all the images, you have to register. The registration is free, but you have to register. You can't just Google it. Unlike TeachMeAnatomy, which is actually available on a website and available for all. So here you have to register. Again, there's also a premium service in which there are complete video lectures. So you've got video lectures here, reviews and quizzes. There also is radiology is also available at Kenhub. However, Kenhub does not have a 3D atlas. That is not a drawback. 3D atlases are not really a necessary tool for learning anatomy. You can learn anatomy just through the regular images, like we've done traditionally, and the wet lab is quite useful. Some students may like the 3D atlas, and if you like it, then Kenhub. I don't believe Kenhub has a 3D atlas. The last I checked, I couldn't find it. I hope I'm not wrong. If I am, I'll have to change it. But they don't have a 3D atlas. But as I said, 3D atlas there or not there is not too much of an issue. So Kenhub is, I would say, in the end, a complete anatomy resource. The registration is free, and the text and images are free after registration, and they are complete. If you would like videos, as well as review quizzes and a radiology teaching, then you will have to pay. They are not free, but it is a complete anatomy resource. All right, next one. 3D4 Medical from Elsevier. This claims to be the most advanced anatomy learning tool available. And I have gone through it, and it may actually be true. It is quite advanced. That said, advanced doesn't mean it is the best. It is just the most advanced. The best is the best anatomy tool that works for you. So it is the most advanced anatomy tool. I would highly recommend that you check it out and see if it works for you. It's got an advanced 3D atlas, a high volume of videos ranging from basic anatomy, clinical procedures, and radiology. So it covers a lot of, almost, as I said, it is a complete anatomy resource. It also has review and quizzes are also included. There is no free version. So you can get, I think, a free account for 3 days. So you can get you can go in free for 3 days and have a look at what it is. And it is quite advanced. And they've got a high volume of videos. So I would highly recommend that you do check this out. You do check this out. It is not free. That said, it is. I don't think it is too expensive. I haven't included the pricing here. Do check it out. But it is a complete anatomy resource and quite advanced. Quite advanced. All right. Let me keep going. Anatomy TV is another online anatomy resource. However, it cannot. You only have access through institutional access. You cannot privately get access to it. I've been trying to get into it and I've not been able to, because you can go through it through institutional. However, you can go through it through your institution, and many medical schools, many universities do have access to Anatomy TV. So do check with your library, and if you have access to it through your library, it is free for you. So that is a good thing. It is an advanced anatomy learning tool similar to 3D4, which we saw here, 3D4 Medical. I would say about as advanced. It has a 3D atlas and has numerous videos with anatomy demonstrations, clinical procedures, and radiology. It also has wet specimen images that they match with a 3D image, like through a 3D atlas, and they also match with radiology. So that I found was a cool feature. So it's got some cool things, and it is a complete anatomy resource. I'm not here discussing the pros and cons of all these websites. I am just putting forward the complete anatomy resources for you, so you yourself go and have a look at them and choose for yourself what works best for you. So this is a complete resource. You will not be able to get access to it if your institution does not have it, but many institutions do. And if your institution does, then you will have it for free. So, go have a look at it. All right. Last but not least, Anatomedia. I am personally quite interested in this because it is an Australian resource led by the legendary anatomy educator, Professor Norm Eisenberg. From Melbourne, and anyone who has done medicine in Melbourne would know of Prof Eisenberg, and so he's completed Anatomedia, which is a complete anatomy resource, and is available online. Many Australian medical schools do have access to this resource through the library, and it is designed primarily for medical students. When you look at the text, it is very clinically oriented. It is text-based. It is very well organized and with clinical concepts, and is quite simple compared to the other online resources, which are fairly advanced. But advanced, it doesn't mean that they are better. They are complicated. As far as information and knowledge is concerned, Anatomedia is a complete resource and has all the information. It does not have videos. It does not have a 3D atlas. It is text-based, but it is among the best organized of all the other resources. It's got a lot of prosected images, and it's got a large radiological suite. I would highly recommend that. Do check it out, and you may actually have institutional access to it through your library, and it may be available to you for free. So I think that ends the complete anatomy resources. So I've got another few here that are not truly complete, but they are great online resources. One is Google itself. You Google any anatomy structure or any procedure or concept, and many websites show up, and a lot of images show up that explain it. And honestly, Google is a truly remarkable resource for quick reference. You won't be able to learn anatomy from it, but if you had a quick question and you needed to just get your head around a particular concept, instead of searching through your resources or your books, just Googling it actually is quite useful. So don't forget to use Google, and I don't think that you will. You will use it quite often. And Wikipedia is one of the best anatomy references. I've rarely have I found an anatomical mistake in Wikipedia's anatomy pages. So if you're looking for anatomy structure and you Google it, a Wikipedia page usually shows up for that anatomy structure, and it is usually accurate. You cannot use these to learn anatomy. They're great for a quick reference, but you cannot use these to learn anatomy. So what you need to do, you need to choose one of the complete anatomy resources that I have mentioned here. So take a few hours, days, or weeks, take 6 months of your first year to review all the resources I've mentioned above, and choose the one that suits you best and stick with it. And what I mean is that you will use that resource to learn your anatomy. And why I'm asking you to stick with one resource is because anatomy ends up being anatomy is not a story like physiology that you read and it's something happening that A leads to B, B leads to C, and so it's a concept that you're understanding. Anatomy is not as such a concept initially. It is a structure. You are using a resource to learn something that exists, like a pot of flour. Somebody can describe a pot of flour, and you'll realize how boring that description is. But this is what you have to learn. So anatomy, all your full complete anatomy resources will teach you all the relevant information. So you choose one, because they're all going to teach you the same stuff. But if you go through different ones, you will never actually get to the end of it. So you choose one that you like, and that will teach you everything. Now, if there is a certain concept in there that you'd like to check from another resource, feel free to do that, and that is good. So use other different resources. There might be a concept that you understand and you want to see how other resources have explained it to give you a different perspective. That is good. Or you might not understand something. You'd like to go to a different resource and see how that resource explains it to you. That is also good. But nonetheless, stick with one. And if there's sometimes go to the others to see what the others are doing. That's actually good to know. But go and all the anatomy resources that I've mentioned. Go through them and choose one that works for you and stick with it. And I'll sort of explain why and a bit of pros and cons of this. Books are good. I mean, there's advantages and disadvantages of both. Books will always be with you as a reference. Like, you buy a book. Anatomy doesn't change, so anatomy books really don't go out of date. I've got books from the 70s of anatomy that are still useful now, and as a matter of fact, they use the same images from that you might see in Moore and Daly or Snell that have coming from the 60s and the 70s. So anatomy do not change. They're good reference, are always with you, and it is important to know your reference, because if you learn something from a particular page, it's always easier to go back to it and learn it. However, they're not interactive, and they may not be available on the go on mobile, even though PDF versions are available for a lot of books and you may be able to find them. So that's what you've got an advantage for the online. They're available on mobile, they're interactive. But one thing I've struggled with online systems is that they go out of business. And when they go out of business, it may not happen this year, next year, but you need to keep this resource you need to keep this throughout your medical school, throughout your internship, and a few years into your clinical training. So whatever resource you choose will be your primary resource for, I say, a good 8 years. And so for 8 years, if one of these things goes out of business, then you're like, that's one advantage you have with the book, that we've had it, you can keep it. So the online issue is they are interactive, they're available on mobile, you've got a lot of videos, but they can go out of business. And if you like reading, then it's hard to read on a device, so a book is a good way to read. So those are your pros and cons. So choose one, whichever one works for you. And so let me recap what I'm telling you. So the most important anatomy learning resource is your own institution's lectures, tutorials, and wet labs. They are truly the most important anatomy learning resource for all medical students, irrespective of which group they're in, whether they're in the minimal group, moderate group, or the maximal anatomy learning group. So for the minimal group, no need to find an extra anatomy resource. So actually, I should have told you earlier, but I'm glad, the minimal group, if you're watching till this end, it's good to know these resources. But if you're sure that you are going into public policy or administration, public health, no need to find an extra anatomy resource. Just focus on the institutional teaching. Use Google. It is really good enough. And use your time to learn the stuff that is important for you and your future career. Do not focus too much on anatomy apart from your institution's lectures, tutorials, and wet labs. That is all you need to know. For the moderate group, again, the lectures, tutorials, and wet labs, as we mentioned. Then review the anatomy resources mentioned above and choose one. I would say choose one and use that resource as a supplement for your institution's teaching. So only go to that resource only going there for concepts that have not been understood in class. So whatever they're teaching you in lectures, tutorials, and wet labs, if there's something in there that you cannot understand, or you feel that, oh, I missed that, I didn't get that concept, go to your anatomy resource of choice and try to understand that concept from that anatomy resource. As I mentioned for the moderate group, do not spend more time learning anatomy more than what your institution is teaching you. So what's the difference between the minimal group? I'm saying in the minimal group, just attend your lectures, toots, and wet labs. If you don't understand it, honestly, let it go. Judge yourself also, but you do not. If you could let it go, even if there's a few concepts that you've learned in lectures and you don't understand them. You could let them go. But for the moderate group, no. If it's been taught in your lectures, if it's taught in your wet lab, if it's taught in your tutorial, you need to understand it. But you need to understand nothing more. So if you're training to be a GP, make sure that whatever they're teaching you in your lectures, wet labs, and whatever the university is teaching you, your medical school is teaching you, you need to know it and you need to understand it. And so use that resource to understand it. But you need to know no more extra. So keep that in mind. And for the maximum group, you must complete all your institution's learning, as mentioned. You must choose one complete anatomy resource, and over the preclinical years, you must complete all of it. So if it's a book, yes, I mean reading it from the first page all the way to the last page. And anatomy reading is not like a book you're reading. It's not a story. Anatomy reading is a description of anatomy, which is there with you next to an image. So when you read your whole anatomy book, it's not that you've like read it in one go. You read a paragraph, and then you look at the image. You try to make sense of what the paragraph is trying to explain in the image, and you have to understand anatomy through it. So you have to actually choose one complete anatomy resource, and over the preclinical years, complete all of it. It's a lot of work, but it can be done. And it is essential knowledge for hospital practice, and you will have to learn it at some point in your career. And as I mentioned, that your lectures, tutorials, and wet labs are not enough. You need to learn this extra stuff. The preclinical years are the best time to learn this, because what I've seen in the past is these students, they go, if they've got a personal interest in anatomy, they learn it, but they also learn it haphazardly. There's no organized way to learn it. I'm trying to organize it a bit for you. And then what happens is that when they go into their intern years and their junior training years, they realize the amount of knowledge they need to know, and then they start trying to learn it then. That is a bad time to try to learn this. The time to learn this, if you have decided that you want to go into a hospital specialty, is to learn your anatomy in your preclinical years. You have to go through one of these complete anatomy resources and finish it in your preclinical years. Then you can use the clinical years to apply this knowledge. And that is my advice to you. Let me just say, any questions or comments about anatomy education, comment below. So whether you're in the minimal group, in the moderate group, or the maximum group, if you have any questions about anatomical knowledge and concepts, anatomy learning tips and tricks, or anatomy learning resources, come down, put it in the comments, and we'll have a discussion about it. And for the minimum and moderate group, all questions and comments are welcome. Let us know how your anatomy learning is going, and we can try to troubleshoot all problems related to the anatomy learning from your comments. We can do that. But for the maximum group, I would like you to watch the next video also, where I will be discussing more about anatomy learning needs for the medical students planning a career in the hospital, and I will be discussing the best way to achieve them. So, in the end, I would like to say I have no association with any of the businesses mentioned in this video. This is my own personal experiences, and these are my own personally researched complete anatomy resources. If you feel that these resources are incomplete, I would say do let me know. And if you feel that there is another anatomy resource that is complete but I have not mentioned, also let me know. Do mention in the comments. At the end, I would say thank you for taking the time to listen to me babbling, and I really, really appreciate it, and hope to stay in touch. Goodbye.